Hello, my name's William Roberts. I'm the National Lead for the Care Homes Vanguard, leading work on enhancing health in care homes. I'm looking forward to you joining me on the digital broadcast. On that broadcast we're going to be talking about the work that's been done across our 6 Care Homes Vanguards. We'll be picking up some of the different aspects within the Care Homes framework and looking at how local areas can start to learn from that work, but also take some of the ideas, take some of the concepts and take the framework and implement it locally. There's 7 big elements in the framework, and it talks about the different things that we think you need to do in a coordinated way to deliver the care homes care model. Looking forward to seeing you on the broadcast, and there's a short video now coming up which will give you some of the information about the things to expect on the day. Many of you are going to be doing lots of great things with care homes in your area. There's going to be some really good work going on already. What's different about the Vanguards is that we're trying to bring together the system so that we do all of those things in a coordinated manner. So why we're going to talk to you about this is so that you can see what those 7 elements of the framework are, and you can see how you can bring them all together in a coordinated manner in your local area to deliver a cohesive care model wrapping around care homes, working with the social care sector and local authorities to deliver better care for the residents in care homes.
The Vanguards comes really out of the 5-year forward plan, and there are kind of 2 things in the 5-year forward plan, I would say. The first one is a shift of care into the community from the hospitals, and then a shift from the community to patients. It's about social prescribing, it's about self-care. Actually, how we define ourselves is compassion, friendship, fun, and assume it's possible.
So I suppose to think about, well, what do I think is really different about some of the new care models? Well, firstly is the fact that they start with the population health as a real idea. So when I come into the offices and I come to your care homes and I come to your practices and I look up on your walls, I see stuff about what your locality is doing and the idea that you've thought about what you need to do that's different in Stevenage from the Upper Lee Valley, but also what could be the same between those 2 places, and how do we really focus on what that population needs, its unique challenges and problems, and how we support those areas to do consistent things, but actually also to allow for the variation that differs in both population, services, rurality, etc.
My question is how nationally we try and to reduce the isolation of the care homes and reduce the isolation of the workforce.
That's where the solution lies, in what William calls this partnership approach. In general practice, it means you've got to extend that partnership into a whole arena of new areas so that actually everyone who works in a care home is part of the general practice team.
You've got to make a lot of noise. There isn't enough noise made about the positive.
If it's just a routine appointment, then that's fine. But unfortunately, what happens with me, 1 minute I'm speaking to you, the next minute I just conk out, and that's it. So I don't remember going into the wheelchair, if I was in the bed, or going in the ambulance, or arriving at the... I don't know anything until they're resuscitating me. The red bag, you know, that's got all my information inside, then that bag's a godsend. Oh, from my husband's point of view, because the next thing is he gets the phone call to say, you know, that I'm at the hospital and which hospital I'm in. So to think that the red bag obviously has gone with me, he knows that as much care as possible will be taken, you know, of me. When you're discharged, the red bag comes with you and it's got everything that you came with. even down to slippers. Not that I wear slippers, but even down to that. Do you know what I mean? So every single thing you went with, that you come back with.
So therefore, going forward, and what is the Vanguard all about? The Vanguard for me and for our system is very much around changing the way we provide and commissioning services going forward. It's very much around using people, public, providers and commissioners working together to think about designing the system and delivering the system in a new way. As I said, we've been very successful in getting this bid. We started a lot of clinical work within the care homes in Gateshead back in 2010, and we've had a steady reduction in our non-elective admissions into hospital from people within care homes by introducing GPs within the homes, working with older people, nurse specialists, and working very closely with our therapy colleagues and local authority colleagues. So where do we want to go from here, and how can the Vanguard programme actually help us? We see it basically looking in 4 main areas, really looking about how we commission differently the community beds and the care homes and home-based services in Gateshead, and really get a joint approach to commissioning those services.
My name's Leslie and I'm a nurse. I love being a nurse. I've spent most of my career specialising in the care of older people, and I've been privileged to be able to do that from the perspective of 3 different organisations, both provider and commissioner. I think what Vanguard means to me is, when I reflect on the last 15 years or so, probably since around the time that intermediate care services first came into being, what I see is that in the past we've made the mistake of providing and commissioning intermediate care services as opposed to an intermediate care system, and Vanguard will give us an opportunity through different commissioning and contracting to pull all of those things together into a system. And in terms of older people's care, that's exactly what we need, a whole system, and I think Vanguard will help us to do that.
I think it's about time, or it's a good time for us to be looking again at like what patients have told us about joining up services, about having integrated provision. You know, patients and service users have been telling this, and families for a long time, that we need to kind of get this right. And I see the Vanguard project as an opportunity to actually accelerate some of our working on this, and hopefully get some great outcomes for patients and people living in the community.
For the last 15 months I've been working with 6 Vanguards, and in those 6 Vanguards they're doing some amazing work. They're doing things to, I think, really to try to do 3 things. Firstly, to bring together closer the NHS and social care to work for the needs of the people we serve, so the residents and the people who need our help, some of the most vulnerable people in society. I think the second thing they're trying to do is to wrap NHS services around those people, so instead of those people needing services reactively, we can actually provide proactive care to them. And then I think the third thing they're trying to do is they're trying to make people like me stop making silly rules that get in the way and make it harder for them to go do their jobs. Whatever you do, don't listen to something today and think that wouldn't work for me. Don't think that won't work where I work for the following reasons. I could spend days telling you of all the barriers why you can't make change happen. Instead of that, think about the one thing that you could adopt or adapt that you hear today.
So some of the issues when a resident goes into hospital, or a person goes into hospital, is that they lose, if their glasses go missing, their teeth go missing, hearing aid goes missing. If they're sent in with clothes somewhere, they may go missing along the line. So actually it seemed pretty sensible that we would look at a transfer bag. The uptake of this has been quite amazing, and I have to say it was a really magical piece of work.
You can understand really how that does support best practice, it's improving the residents' experience. It's really facilitating both that verbal and that written communication. Ultimately, at the end of the day, what we're here for is the residents, isn't it?
Sutton Homes of Care is a Vanguard programme designed to improve care in residential and nursing homes in Sutton. For residents, this will mean they receive more support in the care home, but if they need to go to hospital, this will be as brief as possible. Let's see it in practice. Betty has become unwell, and so Jenny, the care home lead, does an assessment of Betty's condition, liaises with the appropriate service, and a decision is made that Betty needs to go to hospital. While waiting for the ambulance, Jenny packs a red bag to go with Betty to the hospital. What goes into the red bag? Personal belongings, day of discharge clothes, slippers, toiletries, dentures, hearing aid, glasses, and a reading book. Medication, standardised papers, older person's assessment form, cares escalation record, mark sheet, this is me leaflet, and a checklist. The red bag is given to the ambulance crew as part of the handover. At hospital, Maria, the nurse, receives the red bag from the ambulance crew. This holds all the necessary information for her to understand Betty's medical background and provide her with the most appropriate care. This also identifies Betty as a care home resident, so the staff know what protocol to follow. When Jenny comes to visit, Betty is feeling much better, and they discuss her discharge from hospital with Maria and Bina, the doctor. Betty's red bag is packed and ready for her to return to the care home. What goes into the bag? Personal belongings, clothes she came in with, slippers, toiletries, and a reading book. Her standardised papers, the older person's assessment form, cares escalation record, summary of discharge information, this is me leaflet, and the checklist. And her medication. When Betty arrives home, Jenny updates their records with the papers and medication received back in the red bag.
My current role as a care home pharmacist is a really new and exciting one. I get to go and base myself at a care home for the day, and we work together with the GPs and the care home staff to conduct specialist clinical medication reviews which benefit the patient, the relatives, and we optimise their medicines in such a way to keep them from harm and prevent them from having hospital admissions.
From a clinician point of view, I think it reduces my workload quite a bit, since the pharmacist has access to the patient records. It makes life easy because they can make the recommendations easier, and they can speak to me directly, they can look at patient records, and they can discuss with me there and then, and we can decide what to do very, very quickly.
I've learned an awful lot about, especially about the mental health medications, things that don't work together, or why things are certain, you need to have them at certain times, with or without food, which is always very important. Plus any questions or anything we don't know, we can pick up a phone and just ask. So now you've got the GPs, the pharmacies and ourselves all working together as a brilliant team.
It's been great and really exciting to be part of the Vanguard Care Home project, and we have been working in around 21 care homes and reviewed approximately 700 odd patients. We've looked at 6,000 odd medicines, and out of those we have stopped around 700 medicines, including 130 of those which contribute to risk of falls. We've also worked out a direct drug yearly cost savings, and in East and North Herts it's around £96,000, which works out about £131 per patient, so we're quite pleased.
The problem with people in care homes is that they're very frail and have multiple needs, and these people are cared in effect in the private sector, and often care home has its patients registered with multiple practices.
But that can mean that sometimes care homes have 7 or 8 different GP practices going into their homes and into their residents.
And with this fragmentation you get problems with care, and what we're trying to do is actually design care around the individual in the care homes and around the care homes themselves, so they've got coordinated care for all their patients. So when there's a problem, the care home knows who to contact, who's going to respond, and what sort of response they can expect.
We've now got an allocated GP, which means that all the residents know who their GP is and the families all know who the GP is.
We've been able to prevent hospital admissions because they've had that linked person.
This project is making life better for older people by allowing us to test out different types of engagement and assessment and care so that we can understand the best models to take forward and roll out across the country.
I think the Vanguard programme is a very exciting innovation to try and change the models of healthcare within Wakefield.
We've got lots of support.
It's a lovely place to be and I feel lucky.
You never feel lonely. I made loads of friends.
Happy, content and well looked after.
I'm enjoying every moment of it.
We feel a lot more connected as part of the Vanguard.
It's going to be a quicker, easier, slicker service.
When the practice, the staff, the GPs, the care homes collaborate together, the patient can only benefit.
And we're hoping that NHS England will be able to say to the rest of the country, these work, this is what you need to do, and this is the learning that we've got from Wakefield.
Elderly residents at care homes across Calderdale and Huddersfield can now get expert medical advice 24 hours a day thanks to a video link direct to hospital.
A pilot project will run at 18 homes as part of plans to try and reduce hospital admissions and the strain on A&E. Our health correspondent Jamie Coulson reports.
We've got resident Eileen Richardson this morning.
Good morning. Do you prefer Eileen or Mrs Richardson?
Good morning.
If 85-year-old Eileen Richardson becomes unwell or needs medical attention, she can now be seen immediately by a specialist nurse or doctor who's at the other end of a computer screen, rather than going to hospital.
It's nice not having to go out, isn't it, Eileen?
Is it well?
It's nice not having to go outside.
Oh, yes.
Not having to go to hospital.
Oh, yes.
I just wanted to ask you some more questions just about your breathing.
18 care homes across Calderdale and Huddersfield are taking part in a pilot project which provides elderly residents with a secure video link to specially trained staff at Airedale Hospital. Care homes with the highest rates of hospital admissions were selected to take part in the project, and it's hoped that by using this technology they can reduce the strain on local hospitals and their A&E departments.
They don't have to travel, they don't have to sit in an A&E department, they don't have to wait to be seen by a clinician. It can be just done there and then by their bedside. For us is fantastic, and it's putting the patient first, which is what we want to do.
We've used it for chest infections, back pains, minor fits, suspected strokes. We're straight onto the hub and we take guidance from them.
With what you've told us today, I don't think that we'll need to see you again.
The pilot project, which has been funded by the local hospital trust, will run for 12 months, offering patients like Eileen expert advice at the click of a button.
Thank you. Bye.
Jamie Coulson, BBC Look North.